person watching.
Can you see us? You can? Yeah, you can make it so, can you? Do you
I
reckon?
don't know. It looks kind of funny with the light.
Can we try and pull it back?
I don't know. Let us know if you can see us okay.
I might just
Pull it back, Laura.
kind of tilt it more this way.
Maybe, yeah.
That's a bit better, I think.
Sorry, guys.
Go on, keep chatting now.
Welcome to another episode of Ask Physio Erin Live. We are just out and about this morning in Donegal town. It is absolutely beautiful here today. Although it's probably not this morning now, it's this afternoon.
No, afternoon, half one.
Shout out to Blast. We went in there for brunch and it was delicious.
Absolutely.
And then we went for a walk on the bank walk, and I tell you, if you're in Donegal town today and you're doing nothing, get out and do the bank walk. The way the sun is shining, it's just lovely over there. So we're just sitting here now,
Chilling on a Sunday.
chilling on a Sunday. Yep.
Any gossip for the week?
Any gossip for the week? Physio Erin news.
I say gossip. Gossip sounds better.
Any
People
gossip?
only tune in for the gossip. Being honest about
Well, we had our Physio Erin Christmas party on Friday night. So we had a lovely evening. We were lucky enough that Katie, who works with us in Galway, was able to come up as well. So we went to Tommy Tiernan in Bundoran.
it. Yeah,
And
good crack.
it was good crack. It was really good fun. He was very entertaining.
A few
and
controversial issues,
There was,
discussing
yeah.
abortion and stuff
Yeah.
like, but
Yeah, but
You
Tommy's always good. It's good to laugh out loud every now and again. We met some of our Pilates crew there, so that was nice as well. And then we came back to Donegal town, went into McCafferty's for a while, and we're home at a respectful hour with all of our dignity intact, right?
yeah, mostly preserved,
Mostly.
give or take.
Um,
A few embarrassing moments.
Where? What?
You have to say thanks to her now,
Um,
Lucy, here. Careful now.
what else?
There you go then.
Is
Good gear.
there anything else this week?
I don't think so.
No.
Pretty standard week, wasn't it?
Off you go.
Nothing too exciting. It's amazing. We've only 2 weeks left in our Pilates before our Christmas break, don't we?
Yep.
And actually next week, so all of this week, everybody who's in our current classes will hopefully have booked into January, and then on Wednesday of this week we'll be offering all of our extra spots up for our January classes, so keep an eye out for that. Okay, questions.
Yes.
If you have anything that you want us to help with, please do comment below or send us a little private message if you have any questions that we can help with.
Perfect. So the question came in last week at the tail end of the show last week that we didn't get around to, was asking about specifically Achilles Tendinopathy. Is there anything I can do for my Achilles tendinopathy? They've been to their GP, and their GP told them that they have got this
Achilles
tendinopathy.
tendinitis they told them, but
Or
yeah,
tendinitis.
we call it tendinopathy.
So what can they do for that?
Okay,
have it.
so if this person is listening, the first thing that we would, just to give everybody a bit of...
We can edit that bit out.
Live TV,
Yeah.
folks. You're right there, Ollie.
Good. Yeah.
So Achilles, your Achilles is the little cord at the back of your heel that attaches your calf muscle to your foot. They can't see me pointing down there, but that is where your Achilles is. And sometimes, for different reasons, we get irritation of that tissue. So a tendon is a piece of tissue that connects the muscle to the bone. And it's really important because when we walk, when we move a joint, the force has to come through that tendon. We see lots of tendon problems all over the body, so be it shoulder, tennis elbow is an example of a tendon problem. A lot of sort of women in their 40s and 50s get tendon pain on the outside of their hip, the front of their knee, and then one of the most common one we see is Achilles tendinopathy. Now, about 10 years ago, it used to be called Achilles tendinitis because we thought there was an inflammatory element to it. And over the years we've come to realise that actually there's not that much active inflammation going on, so that's why we've changed it to tendinopathy. So to help this person, really the first thing I need to know is what age they are and what caused the problem. Do they recall an event where their Achilles was sore afterwards? So I'll just give an example of sort of the two types that we see and then how we would help them. And if the person is listening, they can let us know. So we'll either get somebody who's maybe under 50 and have done something maybe in their sporting activities or in their exercise habits or they've done something in their life to change the force going through their Achilles tendinopathy. So a few examples is, I had a runner who would normally just do a normal 10k on the roads, up and down on the roads, and then they started doing like cross-country training, and that change in force from being on sort of the fairly level road to hopping on and off different surfaces in the cross-country environment caused the tendon to become aggravated. So what happens is you put load on the tendon that it's not used to, and then a few different things happen. It activates some change within the tendon. Now, if that person comes into us and that they've only had their Achilles pain, less than sort of 4 or 6 weeks, we're laughing, because we know that we can change the load, give them some exercises, and get that settled down quite quickly.
So you would laugh at someone in pain?
No.
No.
By laughing, I mean we know that we can help that person quite quickly with the right advice.
Just want to clarify that you don't laugh at your patients.
I don't. Now, compare that to somebody that might be maybe 65 or 70. Their tendon, as all of our tissue, tends to change over time. And there will be normal age-related changes within that tendon. So that patient might come in and their tendon might be really thick. They'll notice the swelling, maybe even little nodules on their tendon.
What's a nodule?
A nodule is where the tendon is slightly thicker.
So
a little bump.
Yeah,
a little bump on your tendon. Yeah. So if you're having pain at the back of your ankle and you look down and you see little bumps, don't panic. That's actually your body trying to do its best job at repairing the tendon. And those tendons tend to be a little bit more affected by age, and that patient mightn't remember doing anything different. An example I had was a lady who was on holidays in Spain. So in Ireland she's wearing her normal shoes, and then she was away for 2 weeks in Spain where she was wearing completely flat shoes, flip-flops or sandals, and that was enough. That puts a different type of stretch on the Achilles tendon, and she got a tendinopathy off the back of doing that. So that's the usual reason that it happens. So fine, you have pain at the back of your ankle. Normally it's just localized to the back of the ankle, it doesn't move up and down. What can we do to help?
You asking me, or you're
well, if you want to help me, I mean, I'm happy to keep talking.
Like, I think you're pretty good. I mean, we've got a nice
okay,
step
so
there if you
well,
want.
that's not the first thing I would do. If somebody is having pain at the back of their ankle and we think they have a tendinopathy, the first thing that I must try and do is change or modify the load that they're putting on their tendon to stop aggravating it.
What does that mean?
It means that if they're a runner and they're getting their symptoms when they run 10k, I'll say, look, can you pull back to 8? And does that keep you symptom free? So I'm modifying the load in the tendon. Or I'll say, can you just keep it to a flat surface? Maybe if they're on the road, can you just do a bit of treadmill running for a few weeks, so then that they're not going up and down the hills? That modifies the load.
Just jog a little bit slower instead of going at your normal pace to try and just reduce the amount of force and load going through that tendon.
Yeah.
Okay.
So we won't.
That's one thing. So modifying the load.
Modifying the load, yeah. And likewise, if that was my lady with her flip-flops, what I want to do is raise her, make sure she's got on supportive footwear with a bit of a heel, so that the tendon isn't on a stretch every time she takes a step. We might even give her a tiny little, maybe 1 or 2 centimetre heel raise, which is another way of offloading the tendon.
Mm-hmm.
So we'll modify the load on the tendon to try and get it settled down. And then we'll try and sort of manage the pain first and foremost. So we'll do that through a type of exercise called isometric exercises. So if the tendon is really irritable, we might just start that patient with just practicing sort of the type of exercises where your ankle's not moving at all. You're just sort of pushing your toes down into the ground to activate the tendon, and we would show patients that in clinic. Once that is fairly comfortable, then we would start to really increase the load on the tendon as tolerated. Try to strengthen this tendon. So the easiest way to do that is to start with heel raises. You're not going to be able to see here.
You can come up on your toes.
Yeah. See if I can show them. I hope I don't fall down there. So at a first stop, what we'll do with our patients is get them on the floor and just coming up and down onto their toes like that.
Talking a bit louder there, yeah.
Up on their toes like so. Once that becomes comfortable, then I will get them to do it with one leg, maybe holding on to something, up and down like that. Once they can tolerate that, I'll put a true range. And again, they might be holding on for this, so you're going to have over the edge of the step, so you're stretching that tendon first.
Talking a bit louder there as well, because you can.
You can talk them through it if you want, Alan.
Yeah, so you're over the edge of the step, and then you're coming all the way down, pushing all the way up as hard as you can, up onto your tiptoes. This is probably the second or third stage of making it difficult, and then if that's easy, then you're trying to come up onto one foot. And let's see if Kira has enough strength to do a full rep.
Down.
So as you can see, Kira's quite weak at this,
But if they
but she
struggled
doesn't
like
have a
that over the
tendinopathy,
edge,
so
you would go back to the floor and do single leg from the floor first of all. I don't know why I'm facing it now. I do it like this.
okay, we get the idea.
Um,
How many reps and sets? What would you go for?
Okay, well, first of all, it will depend on their symptoms. So you don't have to be pain-free to do this. Tendons don't mind a bit of pain. But if 0 was no pain and 10 was the worst pain imaginable, I would have them working to up to about 4 out of 10 pain. So normally I would pick one of those exercises, depend on how sore it is, and get them to do about 30 reps in the day. So 10 reps, take a break for a minute, 10 more, take a break for a minute, 10 more, and working them as hard as I can to get their pain to 4 out of 10. And I usually do that day on, day off. Do it one day, then rest the tendon the next day. So that will be a central part to my loading program, particularly for that younger patient that comes in with a tendinopathy. Now, for the older patient that might have some change in their tendon anyway, I might supplement their exercises with some strength work higher up the leg as well, to try and absorb some of the force when we're doing different activities before it ever gets to the Achilles tendon. I might get them to do some straight leg raises or side leg lifts, depending on what the patient presents with. So modify the load and then start to strengthen the tendon. That's the two main steps. Any other questions on it?
No.
Other things that we do for tendinopathy?
For tendinopathies that aren't settling,
Yeah.
well, you can look at the.
Back in.
Yeah, you have to sit back down because. There we go. I'll chop your head off. Ooh.
So other things that we do if they're not settling, stretching is not something that we give for those tendinopathies, particularly in the early days, because stretching tends to irritate. It puts a compressive load on the tendon and that tends to irritate it. So if they have tight calves, then we'll do things like deep tissue work or give them foam rolling to do at home, but we won't necessarily give loads of stretching.
That's hilarious.
Take it off the hill. He has it backed up on a hill.
This way.
So we don't give loads of stretching. We do sometimes use dry needling on it if it's not settling. There's some evidence to say that, particularly in the population that are under 50, that doing a little bit of dry needling will activate the body's own healing system. I wouldn't necessarily do it with my patients that are older. It depends, but I'll definitely dry needle their calf if it's tight, but not necessarily straight into the tendon.
But you can look see, like if it's not settling, then you can go down the line of looking at maybe injections for it.
Would you inject an Achilles tendinopath?
No, I wouldn't inject an Achilles.
Me neither.
There's some tendons are a little bit more responsive to injections, such as your tennis elbow or your shoulder sometimes.
And also, when we're talking injections here, we're usually talking like a corticosteroid injection. And a tendon is made up of something called collagen, which is a protein. And corticosteroid can sometimes break down proteins.
Yeah.
So your Achilles tendon is one that you weight bear on. You don't really want to be disturbing the collagen in your load bearing tendon.
So although it would settle your pain, it can
weaken the tendon. Whereas in the shoulder and the elbow, that doesn't matter as much because you're not taking your full body weight through the tendon. So yeah, there would be patients who, if their tennis elbow or their shoulder tendon pain is not settling, we would ask the GP to help us out with some injections.
Yeah.
Why are you smiling?
I'm just looking at myself taking a fall.
Good, Ollie. But before that, we would probably go down the route of NSAIDs if the patient can take them, and of course in conjunction with the GP.
What's an NSAID?
Non-steroidal anti-inflammatory drugs, so your ibuprofen, your Nurofen,
Diclac,
or the gels as well work well on your Achilles because it's so superficial. So that can help it as well. So I think the overall message here is physio can definitely help with your Achilles tendinopathy without a doubt.
Any tendinopathy really.
Any tendinopathy, yep. You just need it needs to be properly managed. That's the key. You need to find the level where you're loading the tendon as much as possible without irritating it. I would say the one reason these tendinopathies go on is because the patients involved can't modify the load because of maybe their work or what they're doing with their hobby, and they don't want to totally come off it. I remember, I know it's not an Achilles, but I had a tennis elbow, a gentleman who worked in a fish factory, and he couldn't stop working, and he was doing the same knife movement all the time, and we did get it settled, but it took a lot longer. So if you're in a position where you can't modify the load, it can be much trickier, and then we might use adjuncts to it if we can't get it settled down. But tendons love load, and let me just repeat that with your Achilles tendinopathy, like there's no way that the load that we're going to put on it would ever damage it or rupture it or anything like that. We're picking a load that we know it can tolerate. So I hope that helps.
Yep.
Do we have any other questions?
No, Sinead.
Sinead. Alright, well.
Enjoy the rest of your Sunday.
Yes,
We'll
yeah.
enjoy.
Yeah. Hope you
Head back
enjoyed
for
the
another
view
walk.
here. Do you know where we are? Anyone guess where we are? We're not too far away from one of our clinics. There's a clue. But it's really, really beautiful up here today. We're somewhere in Donegal town. So yeah, that's us. We're off. Any other questions that we can help with, just send us a direct message, private message, and we will get to it next week. Alright, so that's episode 20 of Ask Physio and Live. Thank you so much for
Is
watching.
it 20 or 19?
Oh, 19. Oh, I'm
19.
one ahead of myself.
One ahead.
Episode
20
19.
next week.
20 next week.
Big
Bye,
birthday
guys.
next week. Take care, guys.